happens to the kids' back-to-school checklist.
Last school year, you may remember, we saw record-breaking levels of flu-like sicknesses and hospitalizations, and measles is also now a big concern, with at least 107 measles cases confirmed across 21 states. Our medical expert, Dr. Mandira Mehra from SSM Health, is here with us this morning. Good morning.
Good morning.
So I always want to give you an opportunity. We've had this conversation about why vaccinations are so important.
Right.
We're talking about a disease, at least in measles, that, I mean, we've been talking about, that can be prevented. Why are these vaccinations so important?
These vaccinations are so important. This is an unacceptable and really just sad tragedy that we see every year. The numbers are reaching record-breaking highs not only in America, but especially in Europe. I know we tend to say, wow, we want to be like the Europeans, right? We try drinking like them and having their healthy lifestyles, but this is one way we don't want to be like them. The anti-vax movement, unfortunately, started from a study that came out in 1998, which has now been revoked. Even one of the authors of the paper lost his medical license. There's no truth to the vaccine autism scare that kind of started this whole movement. The point is that things like measles are very treatable with this vaccine, very preventable, I should say. And so because of that, we know that it's a very infectious disease. It's very spreadable. So when you think about surfaces in schools and children sharing, you know, mucous membranes and being very close in contact, this is a great time to remind parents to definitely not skip that vaccine.
It's the connection and what you can do to other kids. It's not just your own. I mean,
this is the sad thing.
There's kind of like the selfish side to this.
Right. So, of course, you think, well, I'm not going to vaccinate my child, but you have to remember, in daycares, preschools, schools in general, there's small children that are not able to be fully vaccinated at that age, and there's children that are immunosuppressed and lifelong may not be able to be vaccinated. So when we see these outbreaks, it's taking out populations of people. It's potentially deadly. It can cause encephalitis, pneumonia, really just deadly things. And in children especially, the mortality rate goes up. So this is just a great reminder that not only in Europe, but also in America, we really need to vaccinate our children.
We wanted to talk to you, too, about caregivers. There was a study that came out this week that said those who are helping out a loved one, a relative with terminal cancer are up to 7 times more likely to experience some mental health issues. I mean, maybe unsurprisingly, but can you kind of give your take on why this is and whether or not you were surprised by the numbers?
Of course. And so this is something that touches all of us in some way, whether it's our direct loved one or someone we know. And of course, it's distressing. It is a no-brainer, like you say, that it's going to affect us. But I think the number that's surprising here is that 5 to 7 times more likely to have then some kind of mental illness. Something like 70 hours a week are spent caring for someone in their last 3 months of life with a terminal cancer. And so you think about how much we work, maybe 40 hours, some people work 60, but think about trying to work and then also spending maybe 70 hours caring for a loved one.
More than another full-time job.
More than another full-time job that the average American works. So that in itself is a huge stressor, not to mention the lack of support, whether it be financial, mental, those kinds of things. So a study like this really points out all the great aspects that we really need to support people that are caretakers, that do provide such an invaluable service.
Care for the caregiver, for sure.
There you go.
Absolutely.
Yeah.
Dr. Mehra, good to see you.
Great
Thank
to
you
see you
again.
guys.